this podcast is made possible by the generosity of listeners like you. Kindly consider a contribution through Patreon or PayPal. Links are in the details box. Patreon is a monthly subscription that you can cancel anytime, and PayPal is a one-time donation. Any amount is appreciated. And follow us on social media. We're on Facebook, Instagram, and Twitter, the handle, the Beirut Banyan. And you can find us on our YouTube channel with the same name, and you can start watching the episodes as they're released. Thank you for listening, and thank you for watching. I'm Ronnie Shatah, and this is the Beirut Banyan. Fatima, let me start by apologizing. Before I thank you for joining, before I compliment you on your recent piece in LCPS, I need to apologize. I'm diligent with timekeeping, and I always update my software. And I did the software update correctly today, and then I completely missed our appointment. That's because of the software update. So it's a lesson learned. Lesson learned, never do a massive update before recording.
Yeah.
Everything failed. But you're very kind and patient. You let me sort of reboot, and here we are 30 minutes later. First of all, I did not know you're in Canada, which actually maybe it'll offer a wider story here. I thought you were in Beirut.
Mm-hmm.
And I read your recent piece in LCPS about COVID-19 and in many ways the Lebanese state's handling of the pandemic. I just assumed you're in Beirut. Turns out no, you're in Edmonton.
Yes.
Yes. And
yes.
I complimented your lighting. I'm like, oh, that's great lighting for late at night. Like, no, it's noon.
Midday.
It's midday, yeah.
Yes, yeah.
So that actually, I can take the story a little wider and talk about what you're experiencing there as well.
Yeah.
But let me start, though, in Beirut, and we can kind of make our way to Canada.
Yeah.
Right now in Beirut, back in maybe March, April, there was all this social media celebration of the handling of the pandemic. Even among friends, I was receiving messages like, America got it wrong, but Lebanon got it right. And to a certain degree, it was being tackled properly. And this is coming from a naive sort of understanding of what it means to tackle properly. But it seemed the initial stages, Lebanon got it right. Last few days, social media has turned on Lebanon. And now you have these images of sort of gatherings happening, parties on the beach, and people very close to each other without masks on. I think there was a bit of a parody. The Minister of Health talking about, the overcoming of the pandemic while everyone is crowding by him and not many masks are on. So just before we jump into the piece, your immediate reaction to what you're seeing in Lebanon. Do you think the state is still handling it okay, at least compared to other countries that have handled this pandemic? And do you think the population is still taking it seriously enough? Or are they beginning to kind of not make mistakes, but just maybe navigate the moment and letting those masks slip, not taking precautions the way they were maybe 2 months ago, 3 months ago, and just sort of dealing with it in a different way? Just your immediate reaction to both sides, the state and the population.
Well, I would say maybe I think I told you this before you started the recording, but I just want to make it clear that just to put a disclaimer out there. So I'm a public health researcher. I'm, as you said, based in Canada, and I would say at most I'm an external observer and a concerned citizen. I would say Lebanese, of course, and so I'm not, I'm not an expert really on the topic, but I kind of started building some work on this since the beginning of the epidemic and just observing really and trying to kind of criticize or analyze what's going on.
I
So I
prefer
just want to.
talking to concerned citizens than self-proclaimed experts. So I'm glad you're a concerned citizen.
I say I have the epidemiological training and all that kind
Sure.
of technical training that I need to be able to do this. But I would say, and I'm still very concerned. I would say that answers both of your questions.
Yes.
So I wouldn't say it's a yes or a no answer to your questions. But in terms of handling it, as you said, I think, and I mentioned this in multiple times, that I think the way the government handled it so far has been okay, and has been primarily, I think, because of the decisions that they made really early on with like school closures and all that. There's so many issues around the whole strategy overall. Like we could talk for hours and hours around the technicalities of how these decisions were made and how, but we're at the stage where, you close off the whole country. And then that's an easy decision to say, okay, well, shut down the schools, close all the malls, public places, tell everybody to stay at home. But then that can't, we can't keep that forever, right?
Absolutely.
And then and it wasn't really clear if the intent was to, we heard so many times the intent was to, to do risk mitigation and not complete suppression. So the intent wasn't necessarily to reach 0 cases and then say, okay, now we completely eradicated the virus from the country and now go back to normal life and we can have this celebration that people are having now. We're not there. We have mitigated the risk, decreased the number of infections. We're still seeing infections, and that's normal to happen with the approach that has been used.
Right.
It's not clear, this kind of opening up, how it's happening. On paper, we see something. In reality, it's very different. It's not clear how the decisions are being made. So what are the parameters that are we monitoring to say, okay, now we can open up this, or now we go from this phase to this phase.
Right.
That's not clear. And in terms of the public, I think, we say, I say that the government took early on decisions and those were very helpful, but I think a huge element was the people. I mean, I was in Lebanon in March, and I remember there's fear. People in Lebanon were wearing face masks in March.
Right.
And I remember I flew back to Canada through London, and in Heathrow, I was probably one of maybe 3 people who were wearing face masks. In Lebanon, everybody was wearing a face mask at the airport. So there was a huge fear factor. And just in casual conversations with people, we all know there is very little trust, I would have to say, in the health system and in how the government was going to handle the epidemic. So people were saying anything but getting this or anything but getting sick. So that concern, and there's always this expectation with the Lebanese that everything's going to go bad, things will go wrong, so we'll prepare for the worst. We don't have this sense of, oh well, the government's going to take care of things. We always think of the worst, and in this case I think it worked. It helped because it made people really super compliant right from the get-go. And if you remember, even before the government announced the full lockdown, people were asking for declaring a state of emergency, to a point where one of the local TV channels actually declared the state of emergency before even the government did that. So I think the level of awareness of the people and that really, really helped a lot. We see a lot of that changing because I think the strategy of opening up is not really clear. We're not going back to how things were before COVID. That should have been really clear.
Right?
Yeah. We're going back to something, we're opening up into transitioning into a new normal. So we're lifting up some of the restrictions, but these individual level interventions, so social distancing, keeping the 6 feet or the 2 meters apart, wearing a face mask in places where you can't maintain that, washing your hands and so on. These, are should still be in place. There is always a huge gap between what's said and what's done in Lebanon, and that's not just in healthcare, and that's not just public health. We say 30% capacity in public places, and then we see these pictures that you just referred to. And then the problem is, okay, so what happens after this? Well, we know that people will not be compliant, and we know there will be, and that happens everywhere.
Mm-hmm.
But then how do you deal with it as a government? Is any kind of accountability, any kind of, following up on these things? We don't see much of that. So even the piece that you referred to, I just want to say one last thing with that.
But before you do that, I want to add my disclaimer.
Yes.
Although you're not an expert, that is probably the best summary of the pandemic I've heard in Lebanon since it began. So thank you for not being an expert. You've actually raised the standards. Sorry, I interrupted you, but it's a very good way of showing what people got right and what the state got wrong. But I'll let you finish. I'll let you finish that thought.
It was just about the piece that you referred to, like this last piece for the Lebanese Center for Policy Studies, that just kind of reflecting on the exit strategy. That was the whole idea, and it was the hardest thing I've ever had to do. I've ever had to write, and the problem is, when you reflect on something, you have some material, you try and review. Okay, this is what they're proposing. This is what they're doing, and then you go by. Okay, well, let's analyze this. Let's see how this complies. We just have something on paper, extremely simple, extremely brief, very little communication of really what this strategy is,
right.
Very little communication of how we're going to implement it. So the lack of that information, I don't want to conclude and say it means it doesn't exist. So if they don't say the implementation strategy is going to be 1, 2, 3. I don't want to say it doesn't exist because they just didn't share it. So that lack of clarity in all of this is been consistent, and a lot of people raise this issue, and that's why I wanted to focus a lot in that piece on the communication, on transparency, on sharing data, because there are a lot of people who looked at the technical details. There's actually, one group at AUB that provided a document to the ministry and said, these are tools on how to do exit strategies, and it's highly technical. They're incredible, people who know how to do these things. But then you look at what the ministry is sharing, and we don't know in the background what's happening, and I think that's the problem. We don't know. We really just don't know. So I just wanted to say that what I try to reflect on is just with what we know. I don't want to assume they're not doing certain things just because they're not sharing it publicly. So so it was kind of limited, I would say, in that sense.
I think that should be the episode. That was really well said. I'm going to link the piece to this episode. It's called "What is Missing in Lebanon's COVID-19 Exit Strategy," and it actually, the way I read it, is it starts off by showing that there was some consensus between the population and the state, where it's almost like politics and the population's willingness to take it seriously met. And you outline the phases, and it's very easy to follow. But somewhere in the middle, there's a negative sort of, there's a disappointment, I'd say, in how it was handled. And now it's almost like a hopeless case. There's one area I want to emphasize in, though. It says, and you, in a way, I like that you actually, I don't know anywhere else that I've seen the phases written out. And so in a way, you're kind of doing the state's job, I think, and kind of explaining what exactly is going on. But there's a part that I want to focus in. You say, despite the announced dates of reopening various sectors, the plan has not been followed as intended due to several factors. For instance, some sectors identified, and you elaborate on this, phases 1, 2, and 3, have reopened with restrictions, which is what we're seeing at the moment, as well as malls from phase 4, and nightclubs and beaches from phase 5, which is really just the last few days. Yet schools, universities, and other institutions remain closed. As such, it is difficult to assess which phase Lebanon is currently at. Additionally, it is not clear whether the government has updated the exit plan, and if so, what the updated plan entails. Such information has not been publicly announced or shared. Now, I'm going to ask you just your personal reflection. I saw on Twitter something, and I believe it's on your profile as well. It's the Health Nerds. And
Hmm. Hmm.
okay, now I've had wonderful conversations about finance and the economy
Yes.
with the Finance for Lebanon crowd, and they identify
Yes, of
themselves
course.
as nerds too.
The
And
nerds.
yeah, and it's kind of the same conversation. In other words, this is how you can alleviate the economic crisis. This is how you can maybe remedy certain financial pain at the moment. This is how you can have a successful IMF negotiation. That's finance. And it's the same kind of tone. It's that this is how you should do it. This is the only way to do it, and it's not happening. And I sense from your side that there's a similar kind of frustration with the Lebanese state. That even though the know-how is available,
Hmm.
whether you're in Canada or in Lebanon, many people have been writing about ways forward, and maybe the only ways forward, whether it's pandemic or economic
Hmm.
crisis, and the state has very little interest or curiosity. And is that the same thing you're feeling? That, in other words, you've outlined the stages. I mean, this is the phases the Lebanese state set out for itself, yet it doesn't even know which phase it's in and doesn't know how to handle the story or the narrative. So just your own reflection on that kind of dilemma. Technical know-how, and then the state's, I don't know what to call it anymore. It's not incompetence. It's literally just, you know, letting things happen on their own. It's almost like a
Hmm.
hands-off policy. So just your own reflection on that.
Yeah, it's as you're talking, it's just so many ideas coming to my mind. I just the first thing that I want to just highlight before I answer you is just the health nerds. So we actually it's a group same as the nerds, and we called it the health nerds after that group because it's a group also of medical professionals, scientists, researchers, many of which are based in Lebanon, many are around the world, and who also got together and kind of started doing, just brainstorming ideas and trying to think of, okay, what should we do, and also trying to keep the government and the ministry, specifically Ministry of Health, a little accountable. So questioning what they're doing, and it's really just to improve the response to the pandemic.
So you're
So
this collective, if you want to call it,
yes,
this online group is
this
meant
group, yeah.
to channel ideas to the Ministry of Health. That's
Well,
the
not necessarily
oh,
directly because they're
mm,
not working, but just
right.
through social media or through, each in their own institutions, trying to drive the conversation at least around certain things.
Right.
Like we've highlighted in the beginning the issue around testing. So we did some analysis. We showed that, why we have an issue around testing, the strategy of testing, and then around the underreporting of numbers and so on.
Yeah.
There was a lot of, a big campaign that was around correcting misinformation and myths around the COVID. So we're trying to fill in gaps where we felt that this information was not publicly available. And it's we were looked at a kind of a trustworthy group because, it's an independent group. It's not affiliated with any, government organization. And it's just a group of experts that's trying to fill in the gaps. We were actually able also to support some of the local media organizations in kind of understanding the information around COVID or
Right.
analyzing data or how to present it and so on.
So
So
another.
that's
So
kind of just a
sorry to interrupt you. Sorry, but that, in other words, doing the state's job.
oh, absolutely. Well, I mean,
Yeah.
yeah, I mean,
To
of
to,
course.
to a certain degree, filling in the gap of information.
Yeah, well, actually, my personal involvement in this started with me trying to look to see the data that, eventually I ended up working on because I wanted to see, are there any models? Where are we
Right.
at?
Right.
And I couldn't find it. So what I ended up doing is sitting every day, extracting little pieces of data from the reports from the Ministry of Health and compiling this data and doing analysis myself. And I was not really a Twitter person or posting so much, but I wanted to start this conversation and say, okay, are we asking questions around this? What are we doing in terms of testing? What are we doing in terms of this? And then there were more questions, and we were able to contribute to the conversation. I would say more so, but it's not just in health, as you said, in finance, in everything. We have a lot of competent people. We have exceptional talent in Lebanon and abroad who are, who know how to do things, who know the
Yeah.
how to.
Yes.
And you probably heard this a lot, that unfortunately these people are not in the decision-making seat. These people are not the ones who can influence action or policy in Lebanon. And this is not just health. This is every sector.
Absolutely.
And you talked about why could it be, and I think part of it is this disengagement, and we know that this is not new in Lebanon. There is, the government always says, okay, well, we know what we're doing, and then just mind your own business. And I want to say this in Arabic because I heard it in one of the interviews for the Minister of Health, and one of the reporters was questioning.
Please, ما تسبي هون. Then
No, no, no,
we'll get flagged.
No, but it's something. No, I won't. Absolutely not. It's something that the minister said. Actually, I'm not saying any. I'm just re-quoting him because he said it in Arabic.
Sure.
So he said she was questioning the strategy around testing because we were kind of just putting this out there and saying, okay, ask about testing and the strategy. And he said simply, ما حدا يزايد علينا.
Yeah.
And this is, unfortunately, it's just to reflect the attitude. It's not about
how would you translate that the friendliest way possible without yeah.
Don't tell us what to do. And that's not the intent of all these people who are trying to contribute to the conversation and it's not, we know what you're doing, but there is also this sense of they're missing things. Yeah. And your job, you're a public servant. There's so many issues in Lebanon that are much bigger than health and just the Ministry of Health. There's just the whole culture of governance. You're a public servant. You have to respond to me when I ask you a question. Whether you were elected or appointed to a particular position, your job is to do what people ask you to do and pay you to do.
So let me gauge your mind on this, because I'm old enough now to have seen many false starts when it comes to the Lebanese state. What I mean by that is somebody within the Ministry of Transportation decides to enact certain laws. And then suddenly you have these random checkpoints making sure we're all wearing a seatbelt. Just a very ad hoc few weeks frustration where you have traffic piling up.
Yeah.
And okay, that law is implemented. And within a few weeks, nobody's checking anymore. It fades away. But that law is still in the books.
Yes.
This is maybe a silly example given the moment, but I think it matters. The non-smoking policy in restaurants and bars and that kind of stuff. Maybe for a few days, people, they try maybe to follow the law. And I think that law is still in the books. I think it is somewhere in the books. Nobody does it. So that's a maybe naive example, but I think it shows just how the state doesn't follow through. But at the same time, you've outlined phases that the Lebanese state set out. So what is the stumbling block there? The beginning, you have in a way, a ministry doing its job. A month or 2 months later, it's just sort of watching from just sort of, reluctant to even. What is that? Is it that simply that laws are not applied in Lebanon in almost anything, therefore it affects this sector as well? Or is it that they don't treat the pandemic as something critical, that they're really saying that this is maybe hurting the economy more, and therefore we don't want to get involved, we'd just rather not deal with this right now? I mean, do you sense an incentive to just not care about implementing their own laws that were set out in, I think it was March?
Yes, yeah. I don't think it's I think it's more of the first that you said, not that they think it's economically. Yeah, it is economically a problem, and that's part of why we're opening up. So to kind of get the economic cycle back. But I think the issue is there is no concept of accountability whatsoever. Yeah. And then I believe if that does not exist in the institutions, in the government institutions, the individual person is not going to behave in an accountable way. And you cannot come and hold me accountable if I can't hold you accountable as my government. So and this is not now, I'm not talking about this specific government or the specific Minister of Health. This has been the issue of governance in Lebanon, and it's not just the health sector. We're hearing it now with the huge economic crisis, and then the finance sector. There's zero accountability, and I would say zero. I wouldn't even say one. I would say zero accountability. So. And it kind of became ingrained in the culture. Like in Lebanon, people say as a joke, "Oh, there's a law about this, but well, who cares?"
Right.
And right. I mean, when you use perfect examples. These are the things that we see every day. There is no sense of accountability whatsoever.
Right.
And this is how, so we have a major structural issue in Lebanon that goes beyond health. We've, system level changes are needed beyond health. And I mean, hopefully with this, what's been happening in the country, and there are a lot of people who see that these changes are needed and who are driving for these changes. But unfortunately, this happened at a time also where there's so much, turmoil in the country, so there are a lot of issues, and you can't separate. I mean, you can't even evaluate how the public is responding to the government, let's say, mandates or recommendations compared to other countries, given the economic crisis that we have. Given it's very different. The context is very different from there to, let's say, even the United States or any other country, where there's now less compliance.
But that's an important word, and I've, for better or worse, I've grown. And maybe I've heard it so many times, but it's true. Accountability is the big issue, and I think it's in a way, it's the driving fact. It's what people went to the streets for in October. They wanted a more accountable system. They're not asking for miracles. It's just a decent, transparent system that they can hold to account. And that's that's still the struggle, at least in my opinion. It's sort of something that you see in all sectors. And I agree with you, it's systemic. But then comes the population side. And it's in a way, the Lebanese population is probably among the most skilled populations in terms of navigating any storm. I mean, we haven't had 24-hour electricity in how many years in Lebanon? And I mean, we found a way. We found a very, very unfortunate way, but it
works.
It works. That's the generator industry in Lebanon.
Yes.
And it's created its own issues, but it's also, I mean, enough Lebanese have survived this way and seem to have adjusted accordingly. They don't trust the state. Anyway, there's that. And then you have a population that has to deal with a pandemic, and they maybe don't trust the state. Do you sense that is the reason why people took it extra seriously at the beginning? They weren't waiting for the state to tell them what phase they're in. It's almost like, lay off us, we can handle this, we know how to handle everything else. Is it come to that where a population is no longer even curious of what the state's protocol is at this point, that they've given up altogether and they can handle a pandemic their way? And maybe that is why Lebanon did fairly well, at least at the beginning.
Yeah, absolutely. I think that's was a huge element, that lack of trust and the fear of what might happen. And there was very little information. I mean, there's still little information now, but in the beginning. So, and we know that the healthcare system in Lebanon, we know that there are certain maybe centers that are, really great in terms of quality of care and services, but not everybody has access. And and so that's a major issue. And we know that everything, even at the beginning, there was only the Rafiq Hariri Hospital in Beirut was the assigned hospital. So you have people from all over the country worried that if I'm going to get, if I need a test, I'm going to have to go all the way to Rafiq Hariri Hospital to get tested. So people, they know, I mean, this is not just health, in everything. They know what the government is able to do, willing to offer. And in the middle of the economic crisis, I think even the fear level went maybe more up and pushed people to be a lot more cautious. And then throughout the pandemic, this is the other issue, the lack of transparency in the information, the data, and the numbers. I have had so many conversations with Lebanese who are, whether they are medical professionals or just, the average person, people don't trust even the numbers that are coming out every day. I mean, I use these numbers and I go with these numbers because these are the official numbers. But the individual Lebanese, they're like, no, we don't believe these numbers. So which is the most basic piece of information around the pandemic is what is the actual, number. So if people are not even trusting that, of course, you would worry a lot about a lot of other things, and especially now talking about, shortages in medications or medical equipment and things like that. Not lack of clarity around the system capacity, even around COVID. Till today, we really don't know how much of the system is devoted to that, and what's the actual scale of the capacity of the healthcare system to handle, different scenarios. We don't know. We really don't know. So, I mean, I was there in March, and I saw how my family was reacting, and my friends and the people around me, and it's exactly what you said. It is just fear of the unknown. So they were extra vigilant.
There's also something else though when it comes to and these are just, it's imagery. You see masks that are available pretty much everywhere in Lebanon. It's easy to get a mask, and enough people did at the beginning. They got masks, never really an issue. I've been in New York since January. At the first month, I mean, you had to order a mask and wait maybe until May to get it. If you were lucky, you'd find a mask in some shop. It took time to catch up. That to me was very startling. It's like, wow, there are certain things that seem to, emergency handling of any, I mean, Lebanese are good. They can cope with an emergency well. But when it comes to long-term strategy, that's where Lebanon fails miserably. But in the short term, the start, there's something there.
Yeah, absolutely. But just with a comparison, we always have to be really cautious. I mean, you're talking about with New York, within a span of 2 weeks, we went from 10,000 cases to 100 and plus, 100,000 plus cases.
Right.
Lebanon, we're still till today, thankfully. I mean, we're still under 2,000 cases overall.
That's true.
So the scale of it was just.
No, that's an important reminder. Absolutely.
Right? I mean, just to kind of make sure that, not to say that. I mean, again, I said it several times. We're in a very good shape compared to a lot of places.
Yeah.
Just how do we move forward?
But that's a nice segue into another part in your piece, and I'm just going to quote you here. It's a little further down. It says, there are many factors that influence people to change their behavior in times of a pandemic, such as threat perception, communication, leadership, social context, as well as individual and collective interests. In Lebanon, a number of system-level and structural issues have imposed challenges in the response to COVID-19, including a largely privatized and fragmented healthcare system, lack of comprehensive national
epidemiological
surveillance networks, thank you, no effective and transparent communication, low public trust, and significant political polarization. These issues require calls for action in the future. In the mix right now, when it comes to all that we've seen happening, let's go back to October, the push for reform and accountability. Do you see health in that story? And I'll ask it maybe in a broader way. Are people able to cope with that fragmented system? And is it something that you see as maybe not taking a front and center stage when it comes to the protest movement? Or do you see it as something critical, that this is part of the major story, that we need to talk about healthcare, we need to talk about health reform in Lebanon? Because it's not a conversation I hear too often. It came up during the pandemic, but prior to the pandemic, it's not maybe the loudest, it doesn't make headlines, so to speak. But I got from you that it is something very critical. And obviously, the pandemic showed the flaws very clearly. But,
absolutely.
But do you see it in the mix, at least when it comes to the current push for reform and accountability? Or do you think it's something that will stay in the background?
I don't see it in the mix now. I don't see it being discussed, although I think it should be. I believe healthcare should be a basic human right. It's not, health, education, but I think the issue, had we not had the current economic crisis, maybe the COVID crisis would have and the pandemic would have outlined that issue a lot more. Maybe it would have drove the
Right.
discussion more around, okay, because it has in other places, even other countries where there's no universal health care or public health system is weaker. It showed how much of an issue that is during the times of a pandemic. And
Right.
it showed how in countries where you have publicly funded healthcare systems, universal healthcare, it just in terms of at least the access, it's just incredible how different that is and that's one of the bigger discussions now in the US, for example.
Yes. Right.
That's but I think in Lebanon, what's taking over is the really, severe economic downturn. We're in a stage where people are worried about putting food on the table.
Yeah.
So I understand that, and I still think that health is as important. If you don't have your health, that's equally bad, right? But this is where we're in serious conditions in the country, and I think the focus of the discussion is on that. But I think that health should be part of it, and we know that in the private healthcare has kind of took over in Lebanon for many years. The public system is very weak.
Yeah.
And there was some discussion, like
yes,
you said,
exactly.
it kind of came up with especially with designating the Rafiq Hariri University Hospital
exactly. Yeah.
in the beginning, and they said, well, this is a very underfunded hospital, but the incredible team of healthcare workers there and leadership that actually was able to manage throughout this whole pandemic, although it's highly underfunded, and it has been for many years. So it showed that we need to invest more in in our public healthcare system, and that's not to say just completely take over. And there's always pros and cons to both private and completely private or completely public. But Lebanon is a perfect place where you can have both models, but there has to be much more strengthening, particularly in the smaller, non-big cities, in the rural areas of Lebanon.
Right.
Because we know that the bigger, private hospitals, bigger centers are more in the centralized, they're more in the bigger areas with very little access from rural areas in the country.
No, but can I ask you, in a historical context? I only hear about how you could drink water from the tap before the Civil War. We had surplus power. You wouldn't double park on the street, you'd get a ticket. Things that they're silly examples, but they resonate with me. It's everything that you just assume would not happen today that should happen. Historically, healthcare in Lebanon, was it much better than today? Or has it always been a kind of an underserved sector in the economy?
I can't fully answer your question because I'm not very familiar with how the health system was, the historical aspect of it. But what I know is that, after the Civil War, there was a huge investments into the private sector, because the public sector wasn't able to manage all, what needs to be managed during that time and afterwards, and then potentially almost took over the public sector.
Right.
So I'm not sure in terms of the quality of care or the access and all that, how it was prior. But it was, but just knowing, I would say, without studying it in detail, I would say everything has always been so centralized in bigger cities, in Beirut primarily. So the rural areas has always been underserved in terms of healthcare. This is not new, and even in many other aspects, even when you talk about other sectors within the government, always. There's that centralization, and there were reasons for it back then. But that's one of the things. But absolutely, I agree with you 100%. This should be big part of the discussion today when we talk about reforms.
And it's an unfortunate reality that even in the private hospitals, and it doesn't have to be in Beirut, throughout Lebanon, these hospitals are also unable to pay. The crisis has hit them in particular. So it's almost like they're as vulnerable as any other entity within Lebanon. But at the same time, it is a celebrated part of Lebanon that we have such high quality private healthcare. And I always found that as an odd sort of situation, that you can excel in that, and then the rest of the country sort of is unable to do the same thing with education. You have these very, very,
Hmm.
very well-established private institutions, and the public sector is not up to par. But then it's like you said, Lebanon is perfect for both and should be able to celebrate
Yeah.
both in equal measure. And it hasn't.
Absolutely.
Yeah.
Yeah. And I mean, with that, I mean, yeah, I mean, we have great quality healthcare. We have great centers, and it was very popular that, people in the region come to Lebanon to do, for certain health. And we have,
I'm
incredible
so glad.
specialists and
I
so
was
on.
so worried you were going to say plastic surgery, but you didn't, which is good.
Oh, no, no. But the issue is, I think that is great.
Yeah.
But the purpose, in my opinion, the purpose of the healthcare system should be serving also the health of the people in that particular country. I mean, we can't just have, great, whatever, plastic surgery centers serving the region
Yeah.
and not have basic primary care,
Right.
basic care for the people in the country. So people have to think twice. Again, access. This is the issue. I mean, that's why, okay, privatization is good in terms of healthcare, but it shouldn't be the only way to do things, because you're limiting the access of a huge proportion of the population that's actually pretty much paying for that public system. So, for me, I see that it should be serving the people of the country first in a fair way, in an equitable way. Make sure there's access to everybody, and then we can think of having these really fancy plastic surgery clinics serving the region or whatever. But we have great capacity. We have incredible talent in Lebanon. It's just the mismanagement and the governance of it is what's what you end up with these types of issues.
Can I ask you just a personal question? From your own experience growing up and seeing that up close, did that drive you to enter your field for yourself? Did you see yourself as sort of trying to remedy this issue? I'm curious about your own personal relationship, because it's an area I'm very I'm not well versed in health and public health and and the whole sector. So I'm curious what would take someone into that area and become not an expert but a concerned citizen.
Well, personally, I actually I started my background. My undergrad was actually in nursing.
I see.
Okay, I finished my degree and I never worked as a nurse, because when I was doing my training, I realized that, well, first of all, it just didn't, the bedside kind of aspect, the clinical aspect was not very close to me. I was just, it was, I was very emotional with it. Like, so it was really hard to do that part. But the other part was that I'm interested in the population level. I want to do more. So I went into public health right away. So, and then I started training in public health.
Right.
And then I did training in public health, and then I studied epidemiology. But then I realized that knowing the skill or having, the technical aspect of things is not enough. We need to talk about policy. So then I kind of going into this next level. So now I'm kind of studying public policy,
right?
Because I think that's where the change has to happen. And yeah, I did see all of these layers and challenges in my education. Well, I did my undergrad and my master's in Lebanon, and then I moved here for my PhD. So I've seen all these different levels. But yeah, it was. I mean, the number of issues that needs to be addressed and worked on is just endless.
The reason I asked you this, it's a relatively personal question, I know, but the reason I asked you is because I sense from every conversation I've had with these nerds, the conglomerate, whether it's health or finance or any sector, is that this is where politics should be. Because when I read all these pieces and I hear the discussions and I watch them, that's political debate in my eyes. And you see it a very healthy exchange of ideas. And there's almost like a common understanding of what the goal is. Maybe not necessarily how to get there, but there's shared concern and shared interest in getting there. And then you have Lebanese politics the way we know it, which is I don't know what the word is anymore. Yeah, if you could write that, Whatever you just did, if you can do that and like write it out, exactly.
That's
It's
very deep, long sigh.
deep, long sigh. It was. I mean, this doesn't happen, and from my experience, my conversations, it doesn't happen within the system, within the state's orbit, so to speak. If it does happen, it's not common, and it's just not there enough. And
Mhm.
the reason I'm curious is because if the answers are political, but political in this way, in policy and actual
Mhm.
system reform and everything you've been
Mhm.
describing, is there any way to translate what you're suggesting and what all these people are suggesting into political power in Lebanon? Because I'm curious about that disconnect, where you have somebody dedicating their life to improving healthcare in Lebanon, and then you have the usual suspects in Lebanon they seem to be the obstacle. They're the major obstacle.
Yeah.
So
Yeah.
if it were someone like you or someone in your shoes who wants to take this home and use it and implement change, what are the avenues possible?
Well, the first thing I want to say is I think there is, enough talent and really competent people who know what should be done in Lebanon.
Mm.
As I said before, unfortunately, these are not in the
Yeah,
decision-making seat.
right.
I think without a civil state, without a state where people are put in certain positions based on their abilities, based on their whether they fit for that position, without that, it's almost I would say it's impossible
Mm.
to move forward. If we're going to continue with you're going to be hired in a certain position because you belong to this, religion, unfortunately, or to this political party or whatnot, this type of system, I mean, evidently it doesn't work. It's not working. Hope, we can't say we don't have hope, but I don't see with this existing system anything changing at all. I don't believe anything will change. And I think maybe one of the things that, I don't know, I kept thinking about it since the beginning of this revolution. And I said, okay, how do you step forward? How do you push it forward?
Yeah.
Why haven't we moved on? I mean, since we had the Civil War and people still talking, we know there's leaders from that era who are still running the country and so on. And the word that kept popping in my mind was reconciliation. I don't think we've ever had true reconciliation in Lebanon that would actually allow us to move past this existing system. And even, I mean, we're talking here about, public health and a position here and make any change, but it all comes back to that individual person who is so worried about their own, safety. And that safety is, they go back to their own political group or religious group, and they get that safety net from that group. And if we don't go past that, and if we don't get that from the state, we're never going to move forward.
But
We'll
you've
never be able to, and just that moving forward,
yeah.
stepping. It's not like reconciliation is a switch, turn it on and then we're all great. It's a process, but I don't think we've ever done that.
And then I hear the same thing repeated in every sector, that the only path to reform in Lebanon is a civil state. The reason, and let's assume that is the path. Let's go with that. I'm curious always about the way things were before the Civil War. And we didn't have the civil state that you're referring to, which is clear. We never had that. And in modern Lebanese history, it didn't exist. We had some sort of maybe slight majoritarian power sharing structure that faded away with the
Mm-hmm.
Civil War. And then it reemerged in the 90s as
Mm-hmm.
something different, but it's that same power sharing, whatever entity that we're famous for. But before the Civil War, these sectors were not nearly as mismanaged or corrupt. And that I'm sure about. And I've even spoken to economists who talk about, corruption in the 1960s and feudalism and all the things that you would imagine to go wrong in a society, crony capitalism. everything
Mm-hmm.
that was everything that exists now existed back then,
Mm-hmm.
but not nearly to the same degree. So
Mm-hmm.
I'm always curious of what would a civil state do exactly for improving sectors within the Lebanese state,
Mm-hmm.
because it almost seems, and I agree with you, I want the same state, but I'm worried. I'm worried that maybe what you said earlier, reconciliation and properly moving out of a post-war environment, is maybe that's the more important thing. How we
Mm-hmm.
govern ourselves may not be the most important. And that's why I'm asking you this question. I like that you mentioned we never really emerged from the Civil War.
Mm-hmm.
We're still
Mm-hmm.
in that we're still operating as if a civil war exists, just not as many weapons, as not nearly as much
Mm-hmm.
violence.
Mm-hmm.
Am I getting that right from you?
Yeah, yeah, absolutely.
Okay,
And
yeah,
and you said it, it's exactly what I was trying to say is that I think, our goal is that civil state, but I think the road and how to get there, in my opinion, I don't think we can start getting there without that reconciliation.
right,
And then you talked about the pre-war era and the post-war. I don't think the major issue here or the biggest impact was on, we know it was, positions were based on certain positions were for certain religious groups and so
mm-hmm.
on. But what the war did, and we should never forget that, is that sense of belonging, that sense of was no longer for the state. It became to religious groups.
Yes,
I get my safety, I get my protection, I get my from my religious from this whatever within a particular religious group,
yeah,
and we never emerged out of that. I
yeah,
mean, why do we have this now? Why are people so attached to it? And then, people start talking about, well, the rights of this, religious group and that
yes,
religious group and so on. And people are, pushing for that because they feel that a state will never grant me these similar rights.
right, yeah,
While in reality, I
yeah,
mean, a lot of the people you talk to, they're like, I want to go live outside Lebanon. I want to immigrate. While in the, if you go into any of these Western countries where people want to immigrate, a state, irrespective of who runs the state, grants you your rights and
yes,
you have your duties towards that state.
right,
If we establish that, then people no longer need this. You're always affiliated. People have, different religious beliefs and so on. But that's not your sense of belonging is to a country, to a state. It's
right.
not to a religious group. And I think that's the biggest impact post the war. And I'm not talking about this as an expert. I'm just talking about this as a Lebanese citizen who
Absolutely,
grew
yeah, yeah,
up
yeah,
in that time. And
yeah.
I've seen it, and I've seen how around the elections time people start talking about our group and our people and our this and our that. And I mean, you've probably heard this conversation and you've heard people talking about this.
Sure, but
But
in many conversations, I haven't heard the reconciliation priority, and I agree with you. I think that is the first step that wasn't taken.
like growing up, always had questions about the Civil War. We don't study we don't learn about the Civil War in school. We don't learn about it in, even when we talk to our parents, their whole, the sense always تنذكر وتنعاد. That's all they sum it up with just that line. And I started learning about the Civil War in my 20s, reading books of, mostly foreign journalists who were there, Robert Fisk and the
I knew,
like, who were
I
inter-
knew. I mean, I think without even, yeah, it's
and it's like a taboo to talk about the Civil War. And as long as it remains a taboo, as long as it remains something that we don't openly talk about. And this is not about, reconciliation is not about, these people have to pay this price and these. No, it's about coming into terms into what we really want, to a common vision of what we want this country to be like and
but
move forward.
but that's in a
And
way you're bridging the divide, I think, because you're showing two things. You're showing that nostalgia is for the pre-war years, and the pre-war years wasn't a civil state. So nostalgia is for a respecting the state, whatever that is. In other words,
yeah,
a
yes,
relationship with the state.
yes.
That ended with the war, and maybe that relationship wasn't perfect, Maybe it wasn't even great, but it managed. It managed somehow.
Hmm.
Now the relationship is not with the state. The relationship is with regime figures that many people want out.
Yeah,
But I like that you're framing it in a way that okay, you can demand that they leave, but there's still an elephant in the room, so to speak, and
absolutely.
that's reimagining our relationship to the state, and that state ended in the early 1970s. So it's really going back and trying to. It's not patching wounds. It's almost like trying to resuscitate a body that's been left more or less to die. So I actually I like that that is a first step in any direction that is positive. You need to talk about the bigger problem that we never really talked about.
Yeah, yeah. I think we kind of inherited that elephant in the room
Yeah,
from the previous generation,
right.
and I think a lot of people in our generation are willing and are able, and they can have this conversation. And I think it's incredibly important because we can talk about health, and you talk with the nerds about finance, and we can talk about all different sectors. But when the issue is, structural, systemic, state, it's a system level issue, and beyond that, a vision of
Yes,
what it's a vision. What is it? What's the Lebanon that we want? Then talking about these small, yeah, I don't want to call them maybe small, but these technical issues become really um, it's meaningless because
absolutely.
we know what needs to be done.
Yeah,
We know how to do it. We have enough excellent people, competent people who can do it.
yeah.
But
And
this,
there's no need to repeat every few
yeah,
years. I mean, it's all there. Yeah.
yeah,
You know,
yeah.
Fatima, I'm gonna wrap it up with the hardest issue. I've saved
Oh,
the most challenging for the last. So you've been very kind with your time. It won't take too long, I promise. It's
no
just it's
worries.
something that I really wanted to ask you about, and it's the and I think you in a way you phrased it along the lines of that the consensus between the population, the public, and the political
Mhm.
establishment. It may have been there at the beginning of the pandemic, and it's not there right now. And I'm going to quote you to you one more time. At the early stages of the COVID-19 outbreak in Lebanon, there was a relatively high degree of political and public consensus on the need for a strict lockdown. Over the course of the outbreak, consensus has considerably withered due to several factors, including political polarization that is exacerbated by the worsening economic crisis. Political polarization leads to further decrease in public's trust, privileging partisan labels over policy information, believing false information and fake news, and detrimental effects on social and public health. I want to hone in on the economic crisis. And I'm going to maybe try to ask
Mhm.
you to just project a bit coming months that because we are experiencing hyperinflation, I mean, the beginning of hunger, I mean, it's just images that are horrible, that are unthinkable in Lebanon, uh, a worsening situation. And I think it was this morning, another resignation. I think it was
Mhm.
the
Yes.
director of the finance ministry
Mhm.
resigned publicly in protest. So let's assume the economic decline
Mhm.
worsens. And COVID-19 today is not, I mean, you said it to a degree that the state is not sort of tackling it the way it should. And then you have these images of people being maybe a little too carefree about it.
Mhm.
Is this a recipe for disaster? Meaning that the pandemic that Lebanon and you said it earlier, the numbers were not staggeringly high compared to other countries.
Mhm.
Lebanon actually came out okay, so to speak. Do you sense that Lebanon may actually sort of go the other way because of what we're seeing in COVID-19 may only exacerbate the
Mhm.
bad situation we're in?
Yeah, I think there's a very high risk of things going in the wrong direction, and not just in Lebanon. I mean, everywhere,
Yeah.
wherever you open up the economy, more so in Lebanon because of a lot of the factors that you just mentioned, the economy and so on. The scary part and the part that worries me a lot is that it's not really clear this opening up. how it's happening and what are we. So even and that's something I mentioned in that paper is that in the original plan there was like a 1 week period between one phase and the other, and we know that's an extremely short period of time to evaluate. So this is why we talked about all these measures that were taken early on. Shut down everything.
Yes, right.
That's fine. And even though it wasn't done like perfectly well, but the cumulative effect of shutting down everything worked. Now, okay, we'll start reopening up. But when we start reopening up, with everything we have to evaluate, okay, what kind of impact that has on, the pandemic and the epidemiological patterns that we see and so on. That's not clear. We don't even know what kind of parameters the ministry is following and how to, so to be able to predict what's going to happen or to try to predict even different scenarios is really hard because we don't know what parameters they're monitoring in each of these phases. Even now with the opening of the airport, I think this is going to be really critical step. So there's also 1 week between opening the airport for 10% capacity,
yes, right,
and then full capacity.
Yeah.
and we've seen like a few cases in some parts of the country where there was a surge in cases in a particular town because of someone who's coming from abroad, an expat, and
this was early on. This was like maybe a month ago, right? It was one guy spread it to dozens of people. Yeah,
but it did happen actually.
It happened several times, right? Yes,
yeah, but it wasn't the same scale,
right?
But that shows that we have an issue here with what's happening when we open up when people come back, and I'm all for opening up the economy, but it's not just whether we open it or not, it's how we open it and how we monitor how this pandemic progresses as we open all these different sectors. So when people come back, there aren't really any clear guidelines or and more importantly, how do we enforce those 14-day isolation and there's no, I mean, obviously there was no enforcement. That's why we had those few surges and few outbreaks in certain places because of someone coming back.
There was odd instructions about license plate day by day. I mean, odd numbers and even numbers. To me, that seemed like the most bizarre way of trying to handle a pandemic. Limit traffic on certain days. What was that about? Is it trying to just keep people at home? Was that the intent?
Well, you always have to think with these public health measures, there's two levels. There's kind of the overall population level, type of intervention. And then there's the things that we try and recommend at the individual level. So at the global, the kind of population level, we say, okay, shut down public places, schools, trying to eliminate or limit as much as possible people being in close proximity to each other.
Right. Yeah.
And then at the individual level, we say, wear a face mask, wash your hands, get tested, so on. So these should still be in place. These should not go away, the individual level interventions.
Yeah.
The other interventions, it's sometimes I think about what happened in Lebanon, and the way I imagine is that there's this basket of all kinds of public health measures that could be done, and they literally just picked it up and said, okay, do it all, and it worked. But I mean, but there's no. The problem is, I mean, you implement something and you want to evaluate what's the impact of that, so that when you remove it, you also can evaluate what impact that has. So they implemented that odd even car plate. The alternate thing. We don't know what impact that has.
So can I? That's the reason. The reason I brought it up is that really what you're talking about? That they're doing a bunch of things ad hoc and they're not following up. There's no policy at the end of the day. This is just dealing with it as it comes and hoping for the best.
Well, with the lack of transparency and communication around how decision making is being done around all of these measures, that's my conclusion.
Yeah.
If we don't know, and I said this right from the get-go, that I'm evaluating what I see, but I don't know what's happening, how these decisions are being made. With that odd even, if anything, it actually made things worse because it made the roads more crowded at certain times with the curfews and so on. And this is the other issue, is that when you shut down, and we saw where the curfews were implemented in places where the outbreak got out of hand.
Right.
Because it was too, the transmission was way faster than doing, something simple as, just asking people to wear a face mask or wash your hands.
Yes.
So it was a little bit, I think, too much for where we were in Lebanon. I think,
right.
I think the issue with that is that when you tell people stay at home, don't do it, don't communicate with anybody, lock down, and then open the door and say, go to this,
Yeah.
new normal that no
Right.
one knows how to. I think being able to go out with the face mask, with the social distancing, people need time to get used to this new normal. It's not like, we tell people you should do that and the next day everyone is doing it. So that curfew, I think they were extreme restrictions with really, I don't know what the value of these, we don't know what the impact of these were. If anything, it deterred this behavioral change. It kind of made it a little bit harder.
Right.
Because if people were out and about trying to learn to live in this new normal, it would have made things a little bit smoother in this transition. But then, of course, you see things like these mixed images of, celebrations, and you mentioned, with the minister, with that, big celebration that they did. Like that sends like this is a very, very wrong message. And I understand, people maybe were happy and wanted to celebrate that, but the right message would have been, we'll do that when we actually are over this pandemic. I think that was a horrible, horrible message to the general public. Despite the mask and despite all that, I mean, you try and do a lot of work, and then you just take it out with just one image. That's very powerful, and a lot of people, I mean, and you've seen probably a lot of people criticize that, but that does leave. That's why you see that image that we saw 2 days ago on the beaches with pool parties.
Yes.
And you say, okay, well, we talk, back to accountability. Who do you hold accountable? These people should be accountable, but also that same other picture where we had the Minister of Health celebrating with, where do you start, right? Like,
and I know that it would be unfair to blame the average person for wanting to go to the beach, or for that matter, for wanting to celebrate the Minister of Health in something that
absolutely.
he did. But at the same time, you're absolutely right. Those images send the wrong signal.
Yeah. And it's funny enough that the criticism around the beach party was more on the economic side. It wasn't about COVID. I don't think anybody even mentioned the COVID. It was more around, and rightfully so. Like it is, I think from both sides, it's just not the right time for that. We're not expecting that every single person will comply.
Right.
But not those who are responsible for handling this pandemic. And this is unfortunately, I think this is the other issue in Lebanon. There is, I don't know. I think they don't really, evaluate these kind of steps, because something like this has a huge message to the public.
Yeah.
It's extremely powerful, way more powerful than the minister, sitting and maybe explaining the strategy for 3 hours. That image will change people's perceptions of risk, people's behavior, a lot more than a 10-page document outlining what they should or shouldn't do.
At least he had a mask on. That was the only redeeming moment in that whole incident. Is that at least at least he didn't take it off and throw it aside and say we did it.
Yeah. And I mean, going back to your point around the economy and how we're moving forward, I think this is the worst time to send the message that we're fine, because the risk is still there.
Right.
And now we're in a much worse position than we were 3 months ago, 4 months ago, economically.
Yes.
I mean, it's going worse. It's getting worse by the day.
Yeah.
But even there's a lot of talk now around real shortages in medications, in equipment, and so on and so forth. People are not getting paid their salaries in public hospitals. So we're actually, you buy time in a lot of countries, people did these measures, governments did these measures to buy time, to enhance the capacity of the system, and to get people used to this new norm.
Yes.
In this time for us, given the economic problem, that bought time. I know, I mean, we were able to flatten the curve, but that bought time is, the economic situation is getting worse.
Right.
We're not, our condition is not improving. We're not setting ourselves up. So I think people should be now even more vigilant than they were, a lot more cautious than they were, because with time, and we know, and everybody knows who listens to the experts, that this situation will get worse and worse and worse, and that we are still at the beginning of it. So, so I think we're even now, we should be sending the message to the public that, we crossed that first stage of flattening the curve, but now we should continue to be extremely vigilant, because the risk of a resurge is extremely high,
Fatima,
particularly with opening up the economy.
But just a final point, I want to ask you about your experience in Edmonton, in Alberta. There's that kind of, I assume it's a very spacious part of the world. And I assume that there is a lot of distance between people regardless, COVID-19 or otherwise. Have you, psychologically, has that made it easier for some, let's say in your shoes, having seen what Lebanon is going through and sort of going back to this very spacious part of the world? Do you sense that it's just a lot easier because that's how it's designed anyway, that you can kind of go about your day-to-day affairs and not really think about COVID-19 all the time? And then in Lebanon, there's really no way around it. People are very close to each other. It's a very, very, people live on top of each other in very dense quarters. And that there's so difficult to, it's difficult by default in Lebanon to kind of be that distant anyway. So is there something in that you're able to, in a way, not worry about it too much, and then in Lebanon you're kind of forced to deal with it, and maybe you become a little more reckless as a result? You become maybe a little more, I have to live my life somehow, and I'm going to take the risk.
Yeah, I think there are a lot of contextual, differences between, of course, a place like Edmonton in Canada.
I can think of two
Lebanon.
polar opposites, Edmonton and Beirut. Yeah.
You tell you something funny about here being socially distant already and so on.
Yeah.
I told them it seems like I have been preparing for this all my life.
Yeah.
And then I was like, my life was so boring. Like this is because people ask me, what do you miss doing? And I'm like, I'm still working full time from home, but right. And I think I'm like, my life was really boring before COVID, because there wasn't much that I did except for traveling to Lebanon. Right. That was my and I think the for me at least, I think the biggest issue is if something happens, like here, okay, we take our precautions, we're trying there's this collective sense of responsibility that, okay, if I get the virus and, I'm, maybe younger in age, I don't have risk factors and so on, maybe, my chances of surviving through it are high. Yeah. But I still feel that I would never take the risk and put someone else at risk and so on and so forth. In Lebanon, it goes beyond that. If something happens, even personally, like, is the health system able to manage? Right. Where can I go? What's going to happen to me? There's that fear that if something goes wrong, will they be able to manage? So far, the system has been able to manage very well. So we always, thankfully, we haven't gone to the stage of overloading the system, and I hope we don't. But yeah, there are a lot of contextual factors that, whether you compare Lebanon to places like, Italy or, where even New York, where there had, bigger outbreaks. Yeah. But we have also advantages, which are unfortunate, but, we've probably heard this. We don't have a public transportation. We don't have trains. We don't have so which limits the people being in proximity of each other. We don't have the other thing. In Canada, most of our deaths here due to COVID were in long-term facilities and nursing homes. Right. So in Lebanon, the cultural aspect of how, older people live with their children, and they're mostly in smaller villages outside the big cities and so on, that limited a lot of and even in Italy, that was a big issue. So we had things that worked for us we had things that worked against us
You know, you
in a
remind
way.
me. You remind me
Uh,
of the financial crisis, 2008. Lebanon seemed okay. The rest of the world
well,
suffered, but the economy. I mean, the economy is fairly small. We're gonna be fine. The
yeah,
world's collapsing. No, no, we're good. We're good. We're shining.
it's already small. I
Yeah,
mean,
exactly. But I'm curious about these. This is I don't know if it's myth or if it's fact. The
mhm.
smoking may be helpful in terms of transmission, and that when I read that on the news at the earlier stages, that seemed like smokers were less likely to catch COVID-19. Maybe you can correct me if I'm wrong. I thought that seemed a bit odd, that news bite, and I don't know if that is true.
Yeah, I think there was a study in France around whether people who consume tobacco have a lower
Yeah.
risk and not. But I don't think there is, and there was really no actual publication. This was just like during the time when they were looking into the data, and it's something that came out on the news. But there's really no evidence around that,
So
and
there's no benefit for
particularly
Lebanese smoking that they're not catching.
no.
Yeah, yeah,
Yeah, and this is another thing that,
yeah.
they said that hookah, shisha is allowed
Right,
now
right,
in public places. And I mean, even if there's so much, controversy around, okay, how long does the virus, stay on surfaces and you touch or by breathing or by being close and so on. But then it does increase the risk a lot. It doesn't have to be through the pipe. I mean, if you're sitting with someone and they coughed, I mean, we know that that's one mode of transmission. It's confirmed that if you cough in someone's face, we know asymptomatic people, which is a big issue here,
yes,
could transmit the virus to others. Like
right.
the likelihood is
Small.
lower,
Yeah,
but it is still there.
right.
Plus, I mean, smoking when we're talking about a respiratory illness. I mean, you want to avoid that as much as possible because it will. We also know from a lot of studies now that smokers had worse outcomes. And it's logical. I mean,
Yeah,
if you had pneumonia while you're a smoker, you're going to struggle a lot more to recover from pneumonia because that's what potentially a severe case will lead to. It's a pneumonia. You're going to have a harder time recovering compared to someone who doesn't smoke. And any illness, even just a regular, flu. If you're a smoker, I think there's a lot of bottom line. It shouldn't be. There's no protective effect. There's no evidence that there's a protective effect.
right.
And I think if anything, it does increase the risk. By how much, we don't know. But logically, and if we think about what is plausible, it could you could transmit it to someone else.
What's clear is that it's going to be with us for the time being, at least until a vaccine emerges some point in the near future. It's an issue. I hope that does not. I hope it does not impact Lebanon more than it has already. Lebanon is dealing with too much as it is, and
Yes.
what you said earlier is an unfortunate reality that people were focusing in on the beach parties financial issue and less to do with the masks and social distancing. But that is where the pain is at the moment in
Yes.
Lebanon.
Exactly. Yeah.
And
Yeah.
I really appreciate a few things. First, I don't care whether you're an expert or not. I prefer people that deny that they're an expert. They are the experts, in my opinion. It was
Thank
very
you.
helpful for me to learn a lot about COVID-19 through this
Hmm.
conversation. I'll link up the piece, and I want to thank you for letting me do a software update before we spoke. I've kept you for way too long.
Oh
The
no.
the only redeeming factor is that I thought you were in Beirut. So nope,
Uh,
I got away with it at the end. I didn't
hopefully,
keep you awake.
soon. I am planning to go if things continue to be as is and the airport opens, and so I'm hoping to be there soon. But
Uh,
I want to thank you too a lot for inviting me to be a guest at your podcast,
I'll see
and
you
I
in.
know.
No, no, go. Sorry, go ahead. Go ahead.
No, I just want to say that we started with COVID and we talked about, a lot of other things, and it was kind of yeah. I thank you. It was a great discussion. Thank you. I know we can't talk about one thing in Lebanon without just talking about all of these other things, but
You brought up
uh,
reconciliation and you brought it back to reform and you took it to the health sector. That's the conversation I think a lot of people should have, starting again from the basics. And the basics is really what's missing. And
yeah,
you pointed right at it. We didn't emerge from something properly. We left something very big and we don't
hmm
confront it. So, but on the contrary, I'm glad we jumped into that. But I can't wait until I see you in an airport Paris or Frankfurt with your sort of your hazmat suit on and your gloves. And I'm like, oh, I know her.
I did that already in March, so I had some practice, I
I'll
guess.
say hi a few meters away from you.
Yeah, hopefully.
Fatima, thank you so much. I appreciate it.
Thank you. Thank you. Thanks to you.
Thanks for listening. And a friendly reminder to help support this podcast by contributing through Patreon or PayPal. All links are in the details box below. Until next time, I'm Rani Shatah, and this is the Beirut Banyan.